All right, thanks, Sam. Well, several months into this pandemic, we are still washing our hands a lot, and it will be a crucial step to stay healthy and safe as we enter flu season and COVID-19. Joining us to talk about this is Dr. Henry Anyimadu, apologize for that, Infectious Disease Specialist with Hartford Hospital's Hospital of Central Connecticut. Doctor, welcome.
Thank you for having me, Lisa.
Thank you for being back. So hand hygiene was one of the first directives at the onset of COVID. Do you think we have gotten a little lax in hand hygiene practices?
You know, it's very difficult to measure hand hygiene practices even in the hospital setting. But it's very commendable that we keep reminding people about the importance of hand hygiene. It's a very basic yet pivotal tool in the prevention of many infectious diseases, including COVID-19.
All right, so now that we're entering cold and flu season, why is hand hygiene so important?
You know, we know that the principal mode of transmission of SARS-CoV-2 is through respiratory droplets, but infection can also occur through contact with infected surfaces. With increasing community spread, the virus is likely to contaminate many surfaces in our community. We have to be vigilant with mask wearing, avoiding crowded spaces, social gatherings, but we also have to be very vigilant with hand hygiene. We can't do one and neglect the other.
All right, great advice. So it probably bears repeating. What is the best practice when it comes to washing our hands?
We should use alcohol-based hand sanitizers or wash our hands with soap and water for at least 20 seconds, especially when our hands are visibly soiled. We should wash our hands when we are blowing our nose or after blowing our noses, sneezing, coughing, touching our mask, and also after visiting public spaces or caring for someone who is sick.
Okay, great advice. Now, let's talk about this. How can we tell the difference between a cold, the flu, or COVID-19?
Unfortunately, the symptoms are very similar. And for most of these respiratory illnesses, the symptoms are very similar. There is no better way to tell the difference. You just have to get tested.
And doctor, just general advice for the public as we're now heading pretty hard into our second wave here in Connecticut. The spring was so bad, but now we're seeing the numbers spike again. What's your advice to the public?
We're seeing a lot of cases, and the cases are spiking up really quickly. So we have to be vigilant. We have to continue to wear our mask. We have to avoid crowded spaces, avoid even small gatherings. And as we already alluded to, we have to continue washing our hands. The cases are really going up, and we have to be vigilant. That's the only way we can curb the trajectory of this illness.
All right, Dr. Henry Anyimadu from Hartford Healthcare, thank you so much for being with us. Great advice.